All right, so thank you for the introduction. My name is Dr. Hara Kim. I'm a practicing chiropractor in Newmarket and Aurora area. For this presentation, I will be speaking in English, but I do also speak and treat in Hindi and Urdu. मेरा नाम डॉक्टर हरा ख्याम है मैं एक chiropractor हूँ जो न्यू मार्केट और अरोरा एरिया में प्रैक्टिस करती हूँ इस प्रेजेंटेशन के लिए मैं अंग्रेजी में बोल रही हूँगी लेकिन मैं बोलती हूँ और इलाज भी करती हूँ हिंदी और उर्दू में I would also like to acknowledge that my practice is situated on the traditional territories of the Wendat, the Haudenosaunee, and the Anishinaabe people, whose presence continues in Newmarket, Ontario to this day. Presenting with me for the latter half of this presentation is Nancy, and she will be providing her experience of being treated with manual therapy for her chronic pain. But first, let's do a poll question. So I'm hoping that the poll question is available for people in the audience. Alvin, I'm sure you're taking care of that. So we're just trying to get an idea of what the audience comprises of, being either a person or patient with pain, a family doctor or nurse practitioner, other regulated health professionals such as chiros, physios, RMTs, etc., or just a person looking to learn. All right. So it seems like it's pretty divided. So that's a good amount of people from each category. So that's good. Let's continue. All right. So we've got Canada's regulated manual therapists. Now, these are the categorized ones as manual therapy for the purposes of chronic pain studies. This is a combination of CAM or complementary alternative medicine and those outside of that group, such as chiropractors who have recently been recategorized as primary care providers, and and occupational therapists who have played emerging roles in Ontario's primary healthcare system for some time, as the latter already have a foundational working relationship with hospitals and insurance companies. The focus will be on the first three listed, being chiropractors, physiotherapists, and registered massage therapists, as we talk about interprofessional collaboration with medical doctors or nurse practitioners. So low back pain in Canada. In a 2019 study, 41% of Ontario respondents reported having low back pain. Furthermore, it's estimated that chronic or long-term low back pain affects 4 to 25% of the population. So we've determined how common low back pain is, and this is just one type of chronic pain that exists. Manual therapy can be part of the solution if we build interprofessional collaboration. And as patients with pain can attest to, sometimes that responsibility falls on them for being their own health advocates as well. So why look to manual therapy for chronic pain? So these are some of the reasons. Let's start with therapeutic touch because this is a big one. We've noticed in the last few years, especially, the impact of isolation on mental health and chronic pain. And studies have found that comfort is related to therapeutic touch, identified as a modulator of clinical outcomes, so pain. A study by Testa in 2016 concluded that touch is a powerful nonverbal communication tool for therapists. Other aspects of manual therapy, other aspects of treatment that manual therapy provides is a focus on non-invasive drug-free therapy combined with therapeutic exercise and lifestyle modifications to improve quality of life. We act to preserve and restore musculoskeletal health for our patients through focusing on the relationship between structure, so primarily the spine for chiropractors, and function as coordinated by muscles, joints, and the nervous system. And there's always a focus on practicing patient-centered care to increase days without pain, improve activities of daily living, and addressing patient-specific lifestyle habits and goals. So there's growing evidence-based research to support manual therapy as part of a multimodal collaborative approach to address low back pain and other musculoskeletal conditions. For example, a recent study found receiving chiropractic spinal manipulative therapy or adjustments compared with other care for newly diagnosed lumbar disc herniation patients associated with significantly reduced was associated with significantly reduced odds of discectomy or disc removal surgery over a 2-year follow-up. Similarly, in other studies, conclusion recommended spinal manipulative therapy and exercise as part of a multimodal approach together. In response, clinical practice guidelines and medical directives are now recommending the type of therapy chiropractors and other manual therapists provide, such as self-management and physical therapy, as the first and second line approach to low back pain. For example, the Canadian Family Medicine Peer Simplified Guideline for Pain recommends physical activity and spinal manipulation. So health inequities are differences in health status or in the distribution of health resources between different population groups arising from the social conditions in which people are born in, grow up in, live in, work in, or their age. So we do need to understand the definition of health inequities before we can understand what health equity looks like. So health equity, which is the goal, is the state in which everyone has a fair and just opportunity to attain their highest level of health. Achieving this requires ongoing societal efforts to, firstly, address historical and contemporary injustices. Number two, overcome economic, social, and other obstacles to health and health care. And number three, eliminate preventable health disparities. So health equity starts with understanding all diverse backgrounds, including but not limited to Indigenous peoples, racialized communities, 2SL LGBTQIA+ communities, women, and people living with disabilities. So some of the things on a local scale that is being done in Ontario or just at local clinics, as well as my clinic as well, is something you can ask about is fee structure or a sliding scale of fees if you're not able to access healthcare due to a financial barrier. Flexible fee options such as discounts for seniors or students, compassionate care, these are things that some practitioners may offer. Travel workarounds, so home visits is something that some practitioners may offer, or clinic collaborations, which could turn into novel programs, such as some of the ones on the right side. But novel programs would be something more specific to a specific barrier that's noted in that area, such as an area that's not able to access healthcare because the practitioners are too far and everyone is having to travel a few hours to get there. So clinics can be let know about this barrier and they can make a program with other practitioners to address that issue. And then treatment can be offered in multiple languages as well, which is quite a common barrier because we always talk about financial barriers, but often another one is language barriers. So on a larger scale, we do have some things like the Rapid Access Clinic in Ontario, clinics in Ontario, and the Primary Care Low Back Pain Program clinics in Ontario. Those ones go hand in hand a little bit because the RAC or Rapid Access Clinic program is a triaging system for people to receive care if they're not reliant on opioids. But the Primary Low Back Pain program covers the adjacent population, so they do go hand in hand. They have found that 83% of people who've gone through the primary care low back pain program site rely on less on medications, including opioids, for treating their low back pain. So that is good. Other things on the larger scale, such as World Spine Care and Health Mission Outreach, do some global and national work to make sure that they are addressing healthcare barriers by providing outreaches to different communities. Walking with Our Angels and Idle No More are some examples of programs that build on Indigenous awareness, where they're tackling injustices that are being faced. And that includes inequity in healthcare often, and providing resources to help with reducing that inequity in the future. And then we also, of course, have Pain Canada. So one of the bigger things that Pain Canada has been addressing lately is in the last few years, there has been a larger disparity of care for those now identifying with a health-related disability, such as long COVID. Pain Canada is doing great work into bridging that gap in care and providing a voice to those who feel they are living with chronic pain and not being heard. So another poll question. So we want to see how everybody else sees manual therapy. So you can pick any of the options, whatever fits best. All right. Okay, yeah. So most people seem to be going to the listed therapists regularly to treat chronic pain and prevent chronic pain, but also attend to new injuries. So that's good. And we do still have a mix, which is interesting to see as well. All right, so let's look at some of the similarities and differences in Ontario for the chiropractors, physiotherapists, and registered massage therapists. So chiropractors are able to read and send for x-rays, that's a unique one, as well as read CT scans, MRIs, and blood reports. Many patients find it rewarding to have another healthcare provider who can understand and advise on nutritional or exercise modifications that further build on the tests and the advice given from their family doctor. Adjustments can be part of a treatment plan if the patient wishes, but also removed depending on the area being treated and considering the condition. So osteoarthritis is a very common one that sometimes adjustments won't be the first treatment choice. It might be mobilizations and muscle work instead. Moving to physiotherapists, they are able to treat injuries and chronic pain, prescribe exercise accordingly. They can follow up with rehab after surgery and also have a scope of practice in hospitals that is very different than their scope of practice in community settings. So that provides a unique scope. And then we've got RMTs who can provide relaxing but also commonly medical massages. They are equipped to identify muscular discrepancies that should not be there and can sometimes advise on exercise to correct this long term. All of the practitioners listed above will treat patients with both acute and chronic pain. All right, so to foster interprofessional collaboration and in doing so enhance patient outcomes, the Ontario Chiropractic Association, or OCA, hired the Centre for Effective Practice, CEP for short, to develop the manual therapy as an evidence-based referral for musculoskeletal pain clinical tool. So this is a tool that I've used in practice to collaborate with MDs and other healthcare providers, and patients find it useful to carry it around with them like they do their medication list because it's a record of what is being provided in treatment from their manual therapists. CEP is a nonprofit organization that creates tools, pathways, and educational materials for the medical community. They've worked with a family physician-led interprofessional advisory panel for this, which included 2 physicians, 2 chiropractors, as well as a patient with lived experience to guide the tool's development. This evidence-based clinical tool supports physicians and nurse practitioners with the best available evidence for treating chronic neck, shoulder, and low back pain with manual therapy. And since its launch in June 2020, the tool has been downloaded over 7,500 times from the CEP website. You can share this tool for this free tool with physicians and NPs or send them a PDF copy as well. So much of the evidence shows that the best care for MSK pain is a multimodal approach, incorporating patient education, exercise, and manual therapy. So whether we're looking at low back pain, neck pain, or shoulder pain, this was something that was found as a consensus for all types of pain there. A common concern from practitioners that discuss recommending chiropractic care and other types of manual therapies, whether there is research or evidence supporting this recommendation. So this tool provides solid evidence behind a variety of manual therapy treatments for some common MSK or musculoskeletal conditions. This tool provides this evidence as well as yellow and cautionary flags, red flags, clinical best practices, guidelines for referring to the appropriate manual therapist, and a comprehensive resource list. So to support its members and other chiropractors, the OCA also developed additional tools to foster collaboration, including pain reduction forms for low back, shoulder, and neck pain. And this is designed in consultation with a variety of providers to give clear, concise information that quickly highlights pertinent information in a format that's familiar to a primary healthcare professional. Chiropractors can use these fillable forms to communicate their patient's care plan with their MD or NP, as I've used in the office as well. They can use these forms to walk their patient's MD or NP being nurse practitioner, through assessment, treatment plans, and recommendations for the relevant pain. And they're also effective tools for educating patients and for documentation. So I know that patients do find it helpful to be able to look at a chart and see what they're actually receiving for treatment, what they're getting treated for, things like that. So tips for collaboration. So after all of that, here is what patients can do, here is what medical doctors can do. So mentioning this webinar to your medical doctor can be helpful because it can provide information about these forms and about these guidelines. Printing and bringing these forms to your healthcare provider can be helpful as well, because then again, you can start the collaboration yourself. And speaking up about any barriers. That's usually the biggest thing, especially if we're talking about any barriers that you're seeing in receiving any care for manual therapy, or for, if you're receiving one type of manual therapy, but you don't know enough about another type of manual therapy. So for example, I've had patients who come to me and say, so I understand that we're doing chiropractic and I do have a massage therapist, but would physiotherapy also be helpful for this condition? So that is something that I as a fellow manual therapist or a chiropractor can speak to. And I do advise patients when it is relevant to their condition to seek out that fellow manual therapist as well. So that's something that you can bring up with any of your manual therapists. What medical doctors can do. So you can take a look at the CEP guidelines if you're in that category, and you can become familiar with the forms, because this is something that hopefully will be used for more collaboration between MDs, nurse practitioners, as well as manual therapists, so that patients are getting a comprehensive healthcare team looking at their scenario or their condition. Asking your patient about what kind of care they would be most open to as well is more patient centered, right? So if you're finding that you've gone through the guideline and you think that any of the manual therapists listed would be helpful for your patient's pain, then asking your patient which one they would like to try first. That could be more patient centered, and that would give you a better idea of which one would be the most helpful for them, because we do find that something that a patient is already willing to try is probably the one that's going to help the most. So we've already addressed a few of these, but the benefits for the patient for intercollaboration to happen would improve pain control. It would be it create prevention of injury if you're seeing a therapist regularly, and if something does come up, then you can go to them right away about the issue. Having a team approach to everything that's happening, right? So having your physiotherapist, your chiropractor, your medical doctor all looking at the same condition. Make sure that there's a team approach happening, everyone's working together, and then that goes into the next point of repetition of information, so nothing's going amiss. There is obviously improved mobility and strength, as we've seen with all types of manual therapy. And then there is, most importantly, the patient's participation in care, because that's something that's often neglected, but it is one of the biggest things to actually help achieve the right goals and make sure that the patient is getting out of chronic pain. It's their own participation in this care. So accessing care, in general, a referral isn't required to visit a chiropractor, RMT, or physiotherapist in Canada. However, in some circumstances, such as publicly funded community physiotherapy clinics or some extended health insurance plans, a physician or nurse practitioner referral is required to access the funding from your extended healthcare plan. So if you are a physician or nurse practitioner, your recommendations as a primary care provider are critical in helping your patients to make decisions about their health. They may look to you simply for a green light to see a chiropractor or a manual therapist in general, but they may also be looking to you for recommendations. So if you have an existing network that you refer to, this is easy. However, for those who are newer to this may seem a little daunting. So one good starting point is to recommend that they talk to friends or family with similar values to find out who they are seeing. Another is to ask your patients that you know are seeing a chiropractor or a manual therapist in general, who they are going to and what their experience has been like. And finally, if you don't have any leads, you can direct them to the relevant Canadian or provincial association, as many of them offer online tools to find a local provider. So for example, the CCA has a chiropractor locator tool on its webpage, and there are also provincial sites available, such as the OCA, or for registered massage therapists, the RMTO, for example. And then the physiotherapists have collegept.org. As you're making connections, I would encourage you to reach out to chiropractors around you, and they will likely be happy to chat or give a tour of their office. If you know what the process looks like, it can be helpful to your patients as well. So what good care looks like. So when seeking manual therapy, here's some points that a patient can expect to see with a good provider. There should be a comprehensive exam and discussion about the plan of management before any treatment is provided. Patients should feel comfortable asking questions and clarifying what that plan involves as well. There should be a defined period of treatment followed by a reassessment. The College of Chiropractors of Ontario mandates that this must be no more than 24 treatments, but that's not to say that patients should expect to go through 24 treatments before discussing how things are going. If things aren't changing after 4 to 6 treatments, then patients should be asking what can be done differently, or the chiropractor should have initiated this already, or whichever manual therapist you're seeing. And at that point, what I usually find is that after 4 to 6 treatments, if I'm not finding that the patient is progressing enough in their chronic pain, that's when I'm starting to reach out to other manual therapists and try to see if there a collaboration between myself and an RMT might be more helpful for this chronic pain, etc. Fee for service is the norm in Ontario, and although not common, there are also some clinics that may ask patients to sign up for a longer term care plan. Some people may like this, but it doesn't align with an optimal approach to care management. So just be wary of care plans that ask for a lot of the payment upfront. All right, so now let's turn our attention to Nancy to speak about her experiences with manual therapy.
Thanks so much for joining us today. Could you start off by introducing yourself?
Great, thank you for having me. Hi, my name is Nancy. I'm currently 61 years of age. I'm married for 40 years. I have 2 adult daughters, 2 son-in-laws, 4 grandchildren, and 2 granddogs. I'm a retired nurse, having worked for 36 years in adult mental health, both acute and community. I'm currently a volunteer for Pain BC in the pain support and wellness groups, as well as a volunteer for Red Cross, emergency support services, and safety and well-being teams. I would like to acknowledge that I live and play on the traditional and unceded territory of the Ktunaxa, Sinixt, Okanagan, and Kootenai South Métis Nations. My pain journey started in my very early 20s with what appeared to be repetitive use, strain-type injuries, tendonitis, ligament issues, whiplash 3 times, dislocation of my left thumb, left TMJ, and left knee. I have poor tolerance and sensitivity to most medications. My skin breaks down with adhesives, and surgical interventions are not really appropriate for me, so I've relied on manual type treatment modalities throughout my life. My body is very slow to heal. I was misdiagnosed as having rheumatoid arthritis, then later was officially diagnosed with hypermobile Ehlers-Danlos syndrome in 2012 through the BC Medical Genetics Assessment Team. HEDS is a collagen disorder which impacts my entire body in different ways. I have instability in my neck, ribs, lumbar, SI, and pelvic joints, as well as other joint, muscle, tendon, and ligament issues throughout my body. My TMJ functions by slipping and clicking, which I believe is also related to my neck. I'm very susceptible to cervical-generated vertigo, and I have instability in my spine and pelvis, which leads to multiple and variable muscle spasms, headaches, and pain. Despite this history and my syndrome, I've been physically active throughout my life and work at maintaining an overall base level of fitness.
Thanks so much. For our first question, could you tell us about your experience with seeing manual therapists for chronic pain, chronic back pain and/or neck pain?
Yeah, manual therapy and the modalities of physiotherapy and RMT are the main treatment processes that I use to manage my chronic pain. I call this putting Humpty Dumpty back together again, and I say that with humor, as it's also a vital component of how I take care of myself. In approximately 40 years of manual therapy, I've worked with many physiotherapists and RMTs. Overall, this experience has been really good. There have been therapists, though, who did not have the assessment, intuition, knowledge, or listening skills to be able to help me effectively, but I've been very fortunate to have some highly skilled therapy. I believe my therapists have a very thorough and accurate understanding of my body. They've taken time to better understand my disorder so that they can effectively help me and know me much better than my medical GP does. I see my physiotherapist once per month and sometimes more frequently. Currently, I see my RMT every 3 weeks. However, when I was working, this was bi-weekly to weekly. Physiotherapy uses manual techniques to manipulate my ribs, SI, and pelvic joints back into alignment. My neck is more complex, and if treatment is not done bilaterally or very gently, I experience vertigo. I've had poor outcomes with any form of traction, and most work on my neck is associated with manipulation of my first ribs. Validation, assessment, and being heard and helped. These therapists are literally the backbone to my management of my pain.
And what would you say have been some of the challenges of accessing manual therapy, if any?
Well, I think it's vitally important to find therapists who meet your needs and move on if they don't. I've been very fortunate to have extended benefits and enough finances to be able to afford therapy, as well as having choices in who I could see. I know that there's so many people in Canada with limited access to therapy for many reasons. Many people struggling with chronic pain are not able to work or have benefits. I have family members who live in the US, and they also suffer greatly due to the lack of access to appropriate manual therapy. I would like to see that there's more support for manual therapies throughout our provincial and federal governments in terms of having coverage for from our basic medical. I would also like to see more flexible options through extended benefits, so how the monies are allocated could be varied so that there can be greater coverage for the treatment modalities that a person chooses to use. I believe both these options would reduce overall costs to the medical system, and people struggling with chronic pain issues would have better care, support, feel empowered, have better education and preventative measures to maintaining their health. This would then reduce office, urgent care, and emergency visits.
That's fantastic. I think we totally agree with that. How have you advocated for your needs in the past with healthcare providers?
Well, Ehlers-Danlos syndrome is considered a rare disorder. However, I believe this is much more associated with the lack of education and knowledge on the disorder than the rarity of its occurrence. I know lots of people who have it. Information, genetic research, and DNA isolation, as well as classification of subtypes and diagnostic criteria, are changing rapidly. Specifically for hypermobile Ehlers-Danlos syndrome or hypermobile spectrum disorder, the new classifications only came out in 2017. I've had symptoms emerging in my teens and multiple issues evolving throughout my adult life. I didn't feel understood by my GP. I was told by a sports medicine doctor and a rheumatologist that I had hypermobility. So I did the research and I advocated for myself to get a referral to the BC Medical Genetics Program. And it wasn't until after I was diagnosed that my GP actually acknowledged the disorder. There's very little information through med school training on it. I need to advocate for myself with all healthcare professionals. I need special considerations for surgery and dentistry in how they position my neck or support me, the use of medications, tapes, sutures, and adhesives. And even with the manual therapists that are not familiar with me, I need to advocate with them and educate them on what does and doesn't work for my body. Advocating for yourself is so important. And I'd like to say that no one else walks in your shoes. And so you know your body better than anybody else.
100%. And so in this webinar, we've been talking about collaboration between primary care and manual therapists. Do you think that that increased collaboration would be beneficial for you? And if so, how?
Oh gosh, I wholeheartedly believe that increased collaboration between primary care providers and manual therapists is essential and beneficial to people struggling with chronic pain. My therapists know me and my body so well. They have excellent assessment skills, knowledge of the functional abilities specific for me and my limitations. They're the integral core of my ability to function, and having increased collaboration can only improve my primary healthcare provider's knowledge and ability to help me. I believe this would also facilitate speedier access to specialists if you need them, or referrals to other supports. My medical file and history would be more thorough and complete and comprehensive.
Thank you so much. And as we wrap up, do you have any other thoughts or things you wish to share on this topic?
Well, I'm really excited that Dr. Kim is addressing this issue. I really hope that her initiatives will make a difference and begin a process of improving collaborative care for people dealing with chronic pain issues.
Thank you so much, Nancy.
Thank you for including me in this discussion.
Thank you so much, Dr. Kayam, for such an amazing presentation on the value of collaborating with manual therapies for effective management for patients' back and neck pain. And I must say I learned a lot, especially knowing that after you must have defined a period of treatment with your doctor or therapist, you do not always have to do so many treatments. You could actually request a re-evaluation after about 4 to 6 sessions. I'm really glad I learned a lot. And thank you, of course, Nancy, for sharing your experience with us, though you could not be with us today. And we have a couple of questions for you, Dr. Kayam. So the first question is, we do understand that funding, finance could sometimes pose as a very big problem to getting therapy. What would you advise a patient who requires therapy but cannot afford it? Is there any coverage out there, or what would you advise them to do in such a case?
Of course. So firstly, I would say definitely talk to your family doctor and let them know about this financial barrier. There are some physiotherapy clinics within Ontario that are OHIP covered. There are also primary low back pain care clinics that are obviously specific to low back pain, but still that is an available option, that are located in different areas in Ontario as well. I believe one's in Scarborough, there's one in Windsor, etc. That your family doctor can look up and recommend you to, and those are also government funded. And there's also the rapid access clinic, which can triage you to see where you should, like what you need to receive in care, whether it's chiropractic care, physiotherapy care, or registered massage therapy care. So there are these programs out there. There are obviously even more than just those, but those are the three big ones that I would advise on. And then one of the other big ones is that if you do know of a chiropractor in your local area, you might be surprised how affordable it can be to actually receive chiropractic treatment or physiotherapy treatment or registered massage therapy. So it doesn't hurt to, just call the office, ask about how much it is for an initial appointment, how much it is for a follow-up. I know that these questions get forwarded. If a patient calls into my office, these questions get forwarded to me, and I do give them a call back to discuss. And that's just something that's just called a discovery call or a consult call. It's not there's no charge to it. And I know a lot of manual therapy providers will provide that. And we can answer any of those questions on the phone. We can, again, some clinics do have a fee structure, sliding scale, discounts for seniors, things like that. So those are things that if you do let a clinic know about your financial barrier, then they will be more upfront about these fee structures that they do have available, because they may not be on the website, but a lot of clinics do provide that.
Thank you so much, Dr. Kayan, for that information. It feels good to know that there is a possibility of discussing your financial situation with the clinic and not just shying away from it. So I'm glad to hear this. How do you know your neck or back pain requires manual therapy or not? Maybe you had a poor sleeping posture or not. So how would you know if the pain actually requires therapy or not?
That's fair. That's a good question. So more often than not, I would say again, it's good to seek out manual therapy, because this one's a catch-22. You could just, be waking up with neck pain, and you've never had neck pain before. You've never had, let's say, a headache before, and you're waking up with a headache. And you could wait it out, because it could just go away in the next few days. But if it doesn't, then I would say, maybe day 3, day 4, seek out a manual therapist, because it shouldn't be lasting that long. I would say anything longer than 24 hours from just like waking up with pain is not normal. So that can be one indicator. And then another indicator is just that if you're already going and seeing a manual therapist for some other reason, and you happen to have pain for another area, then it doesn't hurt to mention that. So I do have patients who, let's say I see them regularly for low back pain, but then, they randomly were, having a hike and taking a hike, and they did sprain their ankle. So they'll just ask me, like, can you just take a look at it during our appointment? And usually manual therapists are good about that, and will be able to incorporate that into the time that is available for the treatment. And that way you can just get an idea of, like, should I go to a walk-in clinic? Should I go to my family doctor? Do I need an x-ray for this? Do I need something else going on? And they'll be able to either determine, yes, you do need an x-ray, or maybe you don't need an x-ray, and, just ice it, take care of it, should be fine. So that's a good example. So if you are already seeing somebody, even if it's just your family doctor, then just let them know about what's happened, and then they will be able to recommend whether you should seek further treatment for it.
Thank you so much for that answer. Yeah, it's good to know that, any pain lasting over 24 hours should be taken seriously. Sometimes we neglect it. We just tend to think, oh, maybe I did not position my neck well, maybe it's my pillow. It's very important to take our health seriously. So thank you for that. I know you did mention that the 3 major types of manual therapies could be chiropractic, physiotherapy, and massage therapy. Will you advise a patient to consider swimming as a form of therapy for back pain?
Yes, so I highly advise exercise in different forms to be incorporated into care. That's just one of the main things that is always going to be provided. So usually what I do is during the initial appointment, I try to see an idea of what they're already doing for exercise, whether if it's just walks, like taking their dog out for a walk, or going swimming, or going to the gym 3 times a week, whatever that exercise may look like for them. And then we do try to see if the condition is affecting their ability to continue to do that exercise. So for example, if they're coming in with low back pain, and normally they tap dance, and it's the low back pain is getting in the way of their tap dancing, then I would say, okay, let's just hold off a little bit, maybe a week, while we treat the low back pain, and then slowly go back to the exercise, because we do want one of the goals to be that you are going back to the exercise that you wanted to do, that is part of your lifestyle. And if there isn't one that's already part of your lifestyle, then I do encourage an idea of, what do you enjoy doing? Do you enjoy swimming? Do you enjoy riding your bike? Do you enjoy taking a walk? Whatever that may be, it's always encouraged, because sedentary behavior or sitting for long periods of time is shown to be a big contributor to low back pain, neck pain, things like that. So I do advise on exercise in general if it's not already part of the lifestyle, for sure.
Thank you so much, Dr. Kayam. And I have another question here for you. How can chiropractic care in particular help back and neck issues? What would the appointment look like?
Oh, that's a very good question. So back pain, neck pain, any type of pain that's within the spine is usually the bread and butter of chiropractors. This is what we treat the most. So an appointment would look like, after we've done an initial appointment. So during the initial, we do a history taking, a physical of the area of concern. So we ask about all medical history about that area. We ask about certain questions that would give us a better idea of where the pain is coming from, whether it's muscle related, joint related, nerve related. And that's the same thing with the physical. We're trying to rule in and out if it's a muscle related issue, a joint related issue, a nerve related issue, or even something that's outside of our scope of practice, because then we do need to know if we do need to refer to a medical doctor, for example. So after we've done that initial exam and we've given an idea of a diagnosis of, this is pain coming from muscle or joint or nerve in origin, and it's either neck pain or low back pain, then a follow-up treatment or treatment during that initial would look like doing some muscle work to the area, possibly doing some adjustments to that area. I usually, if a patient isn't familiar with adjustments yet, I do talk them through what the adjustment would look like and making sure that I'm gauging their comfort level on that. And then on top of that, we do mobilizations and a lot of education and exercise. And education might include things to avoid doing, things to limit doing. So for example, if they're having low back pain and they're working from home, they're sitting for longer periods of time than they might have been when they were in the office, and going and being able to walk from their cubicle to a meeting room, for example, or going and grabbing a cup of tea or things like that. When people are working from home, they're generally just staying at their desk for a longer period of time. So part of that education might be every hour on the hour, just stand up, stretch a little bit, then you can sit back down, and it resets the posture a little bit, because a lot of things I've been seeing are posture related lately. So that could be part of the education. Now, exercise goes further into that, and I do give exercises and particular stretches that would be more unique to that person's pain, that are particular to low back pain, particular to neck pain, things that they can do in the morning, things that they're supposed to do in the afternoon, things that they can do during the day. And it's always with the goal of incorporating what they are able to do depending on their work or lifestyle. But also things that they wouldn't need too much equipment for, not much props being involved, not something that they have to go to the gym to be able to do. It's something that they can do at home, so that it is something that can be done daily to help to prevent the chronic pain from coming back and to help ease it when it does come back.
Thank you so much, Dr. Kayam. So I have a question again for you. So for example, I am in Alberta, and in Alberta, we have a benefit for people with disabilities called AISH, a short income for the severely handicapped. I know sometimes when you're on AISH, there is a possibility of requesting health services like physiotherapy, massage therapy, acupuncture. So what if you have such an opportunity to get coverage for your manual therapy? Would you advise the patient to have more than one therapy done at a time, or start with chiropractic, see if it helps or not, and then move to the other one? Do you think it's okay to combine at the same time or do them separately?
So my answer is a little bit of both, actually, because I do, again, like all the studies that we have found, multimodal approach, meaning that getting care from multiple providers and multiple types of treatment. has been beneficial to get rid of chronic pain. Now, trying to determine which one is giving you more relief for your chronic pain, that specifically could be addressed by starting with one, just waiting maybe a week, seeing how you're doing with that first one, and then adding with the intention of always, adding on the next. So you can always talk to, I've had patients who've come to see me and they're like, okay, so I do want to start massage therapy as well. When would you advise that? So I sometimes say, like, depending on the area of concern, if it's more on the mild side, I say, okay, let's give it 2 weeks. Let's see how chiropractic's doing for the first 2 weeks for you, but let's book in that massage therapy appointment for you 2 weeks from now, so that it's in the books, that it's coming. But that way you can take a look at your pain just from, chiropractic treatment point of view. But if it is in the more major pain category, then of course, right away, let's get that massage therapist appointment as well. Let's get that physiotherapist appointment as well, because the more care that's being done, as long as it's, spaced out so that the body can recover in between, the better it will be for that patient, for sure.
So if I understand you clearly, we can actually have more than one therapy going on at the same time, where we should start with one for about a week or two. Does it mean that within the week or two, we can have, like, let's say 2 or 3 sessions in a week?
Yeah.
Because I do understand that in certain cases, your therapist might recommend a session per month or a session per week. So how do you play around that if you have to try one thing for a week or two and then move on to the next?
Of course. So definitely that depends on the therapist, and it depends on the area of pain. For example, if somebody is coming in with general low back pain, they've never had low back pain before, and they just started having low back pain, then it is recommended, according to research, that tackling it twice a week can be most helpful, but even just once a week is good for chiropractic care. And then they can definitely get massage therapy as well. Other examples, though, that are a little bit more on the extreme, like a little bit just a little more complex side, I would say, not extreme side, would be lumbar disc herniations. So for that, I know that patients who've come in with lumbar disc herniations, already knowing that they have a lumbar disc herniation, prefer to start with one therapist at a time. They just want to make sure that they're not overdoing it. I'm sure Nancy could speak to that too, when she probably first started with the diagnosis of Ehlers-Danlos syndrome. That's a common one as well, that I usually recommend one therapist at a time, because that is a hypermobility issue, and hypermobility means that if you're moving too much, then you don't want to add more movement too quickly with all the therapists. So a lot of the therapists will focus on stabilizing the body instead. So it depends on what the goals are. It depends on what the condition is. It depends on how often that therapist thinks that they should see you for that specific condition. And if it's a condition that will stay with you, like Ehlers-Danlos, or a condition like just, back pain that just kind of came out of nowhere, you've never had back pain before, likely that you're not going to need to continue therapy for a long term for that. So you can definitely just kind of go for a few treatments for chiro, and then get massage, and just drop down to a once a month kind of check in with your manual therapist, depending on which therapist you're sticking with, or even just both.
Thank you so much. I do understand, as a human being, sometimes you could be dealing with a therapist. They are a therapist, but they do not quite understand your pain like you do. So maybe they will recommend one session a week, or one session twice every 2 weeks. Do you think it's okay to have such a discussion with your therapist to let them know you think you might need more than they think, or than what they are recommending?
For sure. Yeah, I do highly recommend that patients speak up about what they think that they need as well, because I do, when I make treatment plans, I'm usually going with what the evidence suggests. So if they're coming in with neck pain and they've never had neck pain, or they're coming in with back pain, they've never had back pain before, there's certain research that suggests this is how many times you should see them. And then you don't, you just kind of check in. That's it after that. But I do have patients sometimes who have seen me for a while have seen me for their treatment, and the treatment has now completed because their low back pain has gone away, but they do tell me that they would like to check in a little bit more often, just in case. And I wholeheartedly agree, because if you do need that extra little bit, just to a check in, just to make sure that everything's okay, then that's good. Sometimes patients say that it's just great for their mental health as well, just to, you know, be checking in and making sure that everything is okay. That can be the reason. So sometimes it's not quite that the low back pain is still present, but it could be that we're addressing other issues such as the anxiety behind it coming back, or just mental health wise. It can be very helpful to just be checking in with a professional therapist as well.
Thank you so much, Dr. Kaya. We do have time for one more question. Are the resources you shared available to people with pain and healthcare providers outside of Ontario?
Yes, so these resources are on, you know, like you can find them on Google as well. They are provided by the OCA, which is the Ontario Chiropractic Association, but you do not need to be a member, or you do not need to reside in Ontario to be able to find these. I know BC also has another one called the, I believe it's the Pain Passport. They have one that's going like that, that you can access. Again, you just need to Google it. That is very similar to the CEP guidelines. So hopefully soon, very soon, we'll have something more national that will be standardized for everywhere. But in the meantime, definitely access what you can find. And these are available for everybody, no matter which province you reside in. And it's not specific to any province either in terms of how to use the forms or how to use the guideline or the research or anything like that, because research is research, right? If we found that the research tends towards this to be helpful, manual therapy to be helpful for chronic pain, then that doesn't matter if it's in Ontario or if it's in PEI. Obviously, some demographics would be different, but Canada-wide, this is helpful.
Thank you so much, Dr. Kayam, for first your amazing presentation and for sharing your knowledge with us. I thank you too for answering all our questions. So I